So today's session we are going to discuss MCQ questions come from circulation and from respiration. So those two parts we cover. Previously we discussed MCQs from Unit 3, Unit 4 and 5 digestive and animal tissues. So those parts we covered. Here in these sessions we mainly cover past paper MCQ questions come from 2019 to 2025 because those questions can be repeated again and again. So analyzing these questions properly is really important for getting a good result for A-level exam. So I think I shared a document with you. So here, wait, I will share it again. Yes, this one. I shared a document here. It's 2019. So get your PDF or printed copies as well. 2019. We'll start from 2019 paper. 2019 paper, 21st question come from circulation. 21, 43 and 44 questions we can discuss under 2019 paper. So which of the following may be a consequence of hypotension? So hypotension and hypertension, there are two words, right? Under blood pressure topic, you have two topics. Hypertension means sustained elevation of blood pressure, right? Which means like multiple days when you check your blood pressure, then your blood pressure level is in a higher level, more than normal level. What's normal level? 120 over 80. So I think wood level maintain a prolonged period. So then we'll take it as a hypertension. Hypotension it's lower the blood pressure, sustained decrease of blood pressure, we can take it as hypotension. So in your resource book they mention consequences of or complications of hypertension, right? Hypertension complications they mention, and also they mention what kind of things, what kind of incidents will lead to hypotension, right? Example, that accident like sudden bleeding, heavy bleeding can cause hypotension, right? එතකොට දැන් මෙතන question එක අහලා තියෙන විදිහ, which of the following may be a consequence of hypotension? First one, unconsciousness. Second, kidney disease. Third, internal hemorrhage. Fourth, increase in heartbeat. Fifth, stroke. Okay, before going to the answer of this question, can you write what are the complications of, what are the reasons for hypotension? What kind of things can be reason for hypotension? Quickly write. You need to write all reasons, right? Because we are practicing these. So here you need to write all quickly. I will give 1 minute. Okay, so what are the reasons? So I mentioned here possible causes for hypertension. One is shock, sudden shock. Dengue hemorrhage fever. Dengue hemorrhage fever hypotension some deaths occurs. And standing up suddenly. When you lie down and standing up suddenly, this happens mostly in some patients and have to face some very old persons. Their blood pressure levels can't maintain properly once they lie down and suddenly get up, right? and hemorrhage conditions, stroke වගේ conditions වල තියෙන්න පුළුවන්. Hemorrhage conditions means here this is not stroke. Here mainly this bleeding, heavy bleeding can happen. Hemorrhage condition, heavy bleeding, or in a stroke condition means like hemorrhagic stroke heavy bleeding in the and fasting and low nutrition, right? So those are the possible causes for hypertension. So these can causing for hypotension occurs, then hypertension leads to unconsciousness, then faint වෙන්න පුළුවන්, then finally death. Unconsciousness, fainting and death, right? That can happen. Then quickly write what are the complications of hypertension. That's also there's a list, 5 things as I remember. So quickly write what are the possible complications of hypertension, right? If you previous question before that, so 6 points, so quickly mark how many answers correct, so and give you a mark 1 2 3 4 5 6. So out of 6 how many answers correct kila da. So always compare your marks. That's really important to get a good result. Okay, so these are the consequences of hypertension. One is kidney damage. Kidney damage can occur, long-term, prolonged hypertension without any proper treatment. Adrenal gland disorders can occur. So those are very, we can discuss in your university levels, but here no need to know what are the adrenal gland disorders, those things. Heart attack can happen, stroke can happen, finally death can happen, right? So here also 5 points, right? How many points things you wrote, right? So when we move to question now, 2019, which of the following may be a consequence of hypotension? First one, unconsciousness. Second one, kidney damage. So kidney damage related with hypertension. Internal hemorrhage can happen with hypertension because high pressure can damage the vessels and hemorrhage can occur. Increase in heartbeat, hypertension. Stroke also hypertension. Then make a consequence. So consequence hypotension, right? Unconsciousness. So first one is the answer. Right? So some of you guys have already done these questions before, but I need to do this, and all those who guys did these questions before, they are totally questions I think you have nearly 30 questions like, so all questions should be correct, right? So analyzing these questions, because these theory points can again can ask, right? So that's really important. Then here in ගියොත් මම ඒකයි ඔයාලට ලියන්නත් දුන්නේ. Wait, circulation system එකේ then blood pressure what is. So with this question you need to revise blood pressure topic again, right? That's the important thing, because blood pressure essay comes in 2013 in all syllabus. New syllabus no questions yet, so this can ask because a lot of points here: systolic blood pressure, diastolic blood pressure, and then hypertension and hypotension. So hypertension, they ask sustained reduction of blood pressure below normal limits called as hypotension, right? Usually occurs as a complication of other conditions as shock, dengue, hemorrhage fever, standing suddenly from sitting or lying position, over bleeding or hemorrhage conditions, or fasting, low nutrition. So those are the possible causes for hypertension, and this can lead to inadequate blood supply to the brain. Depending on the cause, unconsciousness can happen, fainting, prolonged, possibly causing death. So those points you need to remember. And hypertension, again, I'm not going to discuss more, but there's consequences I ask you to write because it's common question and some guys are not good at those. Risk factors, I think anyone can write, and the definition also need to remember. Right, okay. So we'll move to our next question, 2019 paper. Yes, in 2019, second one, select the correct statements regarding the respiratory pigments of animals. So can you guys quickly write what is an respiratory pigment? Define that term quickly. Respiratory pigment. Okay, I think you have wrote. So respiratory pigment here, define respiratory pigment. So 3 points we can take. First one is it's an organic compound. You should write it's an organic compound and which can combine with oxygen where the partial pressure of oxygen high. Like in lungs වලදී then oxygen partial pressure එක high නේ. Lungs, close to lungs, those blood capillaries has high partial pressure of oxygen. So they can bind with oxygen, right? On the example like hemoglobin, right? Hemoglobin bind with oxygen and forming oxyhemoglobin in the lungs, right? Lungs well. But third point, and release oxygen where partial pressure of oxygen is low. Like when that hemoglobin travel into cellular level, what happened? Their oxygen level is low. In cellular levels or carbon dioxide level is high. So what happened is when oxygen, partial pressure of oxygen level low now, then this respiratory pigment can release oxygen, right? Then oxyhemoglobin විදියට ගිහිල්ලා then hemoglobin release oxygen into the cells, right? Capillaries වලින් release කරනවා cells වලට. Then again hemoglobin back to lungs, take another oxygen molecule, comes to cellular level, right? ඔය විදියට වෙන්නේ වැඩි. හරි. එතකොට අපි දන්නේ hemoglobin විතරයි. හරි. So if you guys wrote these all three topics, all 3 points, so give your marks. So we know only hemoglobin, right? But there are other respiratory pigments as well. In your book they mention several of those. So can you quickly write all those respiratory pigments and which animal groups having those respiratory pigments? So quickly write all. I'll give 2 minutes. Okay, so these are the respiratory pigments in kingdom Animalia. Hemoglobin is the common one, most prominent one. Then hemocyanin, chlorocruorine, hemoerythrin, and myoglobin. Right, myoglobin. So hemoglobin, who has hemoglobin? Vertebrates, including humans, and annelids. Annelids ළඟ තියෙනවානේ. කට්ටිය ගොඩක් අමතක කරන එක hemoglobin තියෙනවා annelids ළඟ. ඊට පස්සේ hemocyanin තියෙන්නේ like open circulatory systems වල. එතකොට arthropods and mollusks we can get, right? Some mollusks having closed circulatory system, but others having open circulatory system, so hemocyanin comes under there. Chlorocruorine, many annelids on annelids ළඟ තියෙන තව එකක් chlorocruorine. And hemoerythrin, some annelids, and brackets are invertebrates also. So annelids having three annelida phylum having three respiratory pigments that depends on the animal: hemoglobin, chlorocruorine, and hemoerythrin. So remember that can be asked. I think previously also they asked. Myoglobin in vertebrate muscles වල තියෙනවා. අපේ muscles වල myoglobin තියෙනවා. So එතකොට අපි fish වගේ ගත්තොත් සාමාන්‍යයෙන් chondrichthyes, osteichthyes වල they comes under vertebrates, so they having myoglobin, right? So you know, remember that most people think when they do questions myoglobin is in only humans, not that it's in vertebrate muscles, right? Vertebrate muscles. Okay, we'll move to question number 2019 or second 43rd. So 43rd, this is a ABCD question. A, myoglobin is present in bony fishes. Yeah, bony fishes ළඟ තියෙන්න පුළුවන්. මොකද vertebrates නේ. Then second one, myoglobin is present in mollusks. Hemoglobin not in mollusks. Right? Mollusks having hemocyanin. Chlorocruorine is present in annelids. Yeah, chlorocruorine. Some annelids having chlorocruorine. Hemoerythrin present in annelids. Yeah, some annelids having hemoerythrin. Hemocyanin is present in reptiles. No, reptile is a vertebrate group. They comes under. So then hemocyanin is in only what? Arthropods and mollusks, so not in reptiles, so that's wrong. So A, C, D, second one is the answer. Okay, so then 44th, smoking is another important topic. This can be asked in essay paper also. There are a lot of points there. Before going to this the question, we'll take few minutes to discuss that smoking. Before that, can you tell me two chemical compounds which are in cigarette smoke? Two very common ones. So those are harmful for us, but for educational purpose we have to learn. So what are those? Yeah, can you put into chat? One is carbon monoxide. One is carbon monoxide. Then the other one, what is the other one? Nicotine, right? Nicotine is the common other one. Okay, so and the other than that, lung cancers, 90% of lung cancer patients are what? They are smoking people, right? So it's a very obvious number. So that's also remember, cancers can occur due to smoking. And we'll see what are the other things we can write. Cigarette smokers harms nearly every organ of the body. respiratory system, including organs of respiratory system, risk of illness, disability and death. So then nicotine is inhaled in tobacco smoke, which is the addictive drug in the smoke, the temporary increase of heart rate. So that point is really important. මේ nicotine වලින් කරන එකක් තමයි temporary increase the rate of heartbeat and it constriction of peripheral blood vessels, right? Peripheral blood vessels. Attanama constriction of blood vessels happens, so because of that temporary increase of heart rate occurs. So this can lead to heart attack at the end stage. Cigarette smoke stimulates the secretion of mucus by goblet cells and inhibit the action. And that's also important. You need to write if they ask essay question. Secretion of mucus by goblet cells inhibit the action of cilia in respiratory tract. Right? So this will lead to accumulation of mucus inside the bronchioles and blocking them, right? Leading to bronchial inflammation and bronchitis on a tower. Condition bronchitis. Previously I told you cancers can happen. Lung cancers is it's bronchitis. Bronchitis occurs with the bronchial inflammation, which accumulation of mucus and blocking them inside. Then the third point, some chemicals such as hydrogen cyanide. On තව එකක් මම දෙකයි නේ විශ්සෙල් මෙන්න එකක් hydrogen cyanide. Hydrogen cyanide in cigarette smoke stops the cilia from working properly. Due to the loss of action of cilia, dust and other particulate matter get controlled, resulting in an increase of phagocytic cells in lung tissue. Due to release of large amounts of lytic enzymes of these cells, alveolar tissue is destroyed, thus reducing effective area of available gas. So here guys, right, due increase in phagocytic cells in the lung tissue, right? Then it can lead to release lytic enzymes. Phagocytic cells function is separately happens, like it's engulfing thing, and also this accumulation of dust and other particulate matter that will leads to release of large amounts of lytic enzymes. So two things happen with cilia action stops. When once cilia action is stopped, one is phagocytic activity, and the other one is lytic enzymes. Right? So those two can happen. Alveolar tissue is destroyed, thus reducing the effective area available for exchange. So both because of these two things, it will reduce, because lung tissue is damaged, and it will lead to reduce of available space for gas exchange. Then next point, carbon monoxide, another one I told you before. Carbon monoxide present in tobacco smoke is absorbed into the blood and is able to bind to hemoglobin and better than oxygen. That's the most important thing, right? So carbon monoxide can bind with hemoglobin, but the thing is, like the affinity for carbon monoxide of hemoglobin is higher than oxygen, right? So oxygen එක බැඳෙන්නේ carbon monoxide එක බැඳෙන බැඳිලා හදනවා compound එකක්. මොකද්ද? It is called carboxyhemoglobin. Therefore that name is not mentioned, and this combination is irreversible one, right? Irreversible one. ගැලවෙන්නේ. එතකොට අර oxyhemoglobin හැදෙන තියෙන hemoglobin amount එක reduce වෙලා යනවා. Thus it decreases the amount of oxyhemoglobin produced, therefore oxygen transport through blood is decreased. So that can happen. Then the last point, tobacco smoke also contains a large number of cancer-causing substances. Cancer-causing substances we call as carcinogens. So remember that term. I don't know whether it's included as a point, but the term is important for you. Nearly 90% of lung cancers due to smoking. I told you earlier. Long-term exposure to such chemicals, cigarette smoke, result in proliferation of cells in the bronchial epithelium. Proliferation of cells in the bronchial epithelium, forming a mass of abnormal cells. A cancer may develop among these cells. If these cells break free, the cancer may spread to other parts of the lungs and metastasis. We call it as metastasis. I think second lesson you'll learn that. So if these cells damage or break, that can spread to other parts of the lungs or other organs, right? So then passive or second-hand smoking will also result in above mentioned ill effects. Passive or second-hand smoking. Pregnant at him, the husband is smoking, then it will lead to damage for baby and the mother also. So a lot of points here. This can come to A or B part of a question, because nicotine is doing one thing, and then hydrogen cyanide doing another thing, and carbon monoxide doing another different thing. So different actions related to these conditions, and that will lead to bronchitis and lung cancers. Finally, it's lead to death, right? So a lot of points. So we'll move to question. Wait. Right. Smoking. A, this is also ABCD question. A, stimulates the secretion of mucus by goblet cells in the respiratory tract. Stimulates secretion of mucus by goblet cells in the respiratory tract. So we discussed that part. That happens due to what? Why that happens? Huge amount of secretion production due to it inhibit the ciliary action, right? It inhibit the ciliary action, and also cigarette smoke stimulate the goblet cells to produce more mucus, and then that will block. That mucus is accumulate inside the bronchial tree, and it block the pathway, and it cause bronchitis, right? So then it takes some time. Then causes tuberculosis. No, tuberculosis අපිට කොහෙවත් හම්බුනේ නැහැ. Bronchitis and lung cancer තමයි අපිට හම්බුනේ. So it's just wrong, right? එතන ලියා ගන්න bronchitis or lung cancers. C, so first one correct. C, decreases the oxygen transport in blood, due to carbon monoxide, it forming carboxyhemoglobin, and it reduces the hemoglobin for oxygen transport. D, so it's correct, right? Correct. D, inhibit the action of cilia in the respiratory tract. It's connect with this. It's also correct. Reduces heartbeat. No, heart rate is increasing. So answer is 2, right? Answer is 2. Right, okay. So we cover 2019 questions, but 2019 paper questions, 3 questions, but we take half an hour time because we discussed most theory parts. I think it will be important for you guys. So we'll move to 2020 paper. So there are 22, 23 and 43, 3 questions again. I think you have done that paper question, 3 questions. Directly we will move to discussion. I sent you this 2-3 days before. So I asked you to do this and complete this because we discussed on Tuesday morning. So I think you guys complete that. So then 22nd, this So yesterday you wrote our full paper, MCQ and structured paper. I will give you the marks, and Friday we will discuss that, right? We will discuss that, especially MCQs, because we can cover a lot of area with the MCQs. And essay papers also will try as a recording, or I will give you more important points. What are the things? And essays you need to write, right? Essay time is not enough for writing essay yesterday, but previously we wrote as a MCQ one week and essay 1 week. But I think doing MCQ and structured every week will improve you, because we are in last 8 weeks like time. So essay paper you wrote and upload to our Google Drive. Then I will check that also. You also can check that, because I will sometimes take time for that. Some handwriting isn't very good, so it's taking time. Okay, we'll move to 2020. First one, 22nd one. This question is based on the following: A, B, C, D. You have 4 points. A, movement of limb, contraction of cardiac muscle. Movement of lymph. What are the things? What are the reasons for, especially movement of lymph from bottom of the leg to upwards? What are the factors affecting for this movement? Contraction of not cardiac muscles, right? Not what are the muscles? Skeletal muscles. And also other thing is like their valves are locating. So valves block the pathway for downward direction. It always open for upward direction. That also help the movement of limb. B, exchange of gases in capillaries. Active transport. No, not active transport. It's what? It's passive diffusion. Then C, clotting of blood, formation of thrombin. Yeah, that's true. Once in the clotting of blood, formation of thrombin happen. Prothrombin becomes into thrombin, right? What is the other one? Thrombin then convert fibrinogen into fibrin. So what is the iron responsible for involved in blood clotting process? What is the iron? What is the vitamin? So these two are common questions. What is the iron? Calcium 2 plus. What is the vitamin? Just guys put your answers in the chat. Vitamin K, right? Vitamin K. Okay, then D, transport of carbon dioxide in blood, participation of red blood cells. Yeah, red blood cells involved in carbon dioxide transportation. Red blood cells having hemoglobin binds with carbon dioxide and forming what? Carb amino hemoglobin, but not much, right? In highest proportion can bicarbonate ions within carbon dioxide. Red blood cells also involved in that process. Bicarbonate, amino hemoglobin, and plasma also can transport carbon dioxide. There are 3 ways that clearly mentioned in your book. So answer here, second contribute to first kill and hand. So then CD, right? CD, answer number 5. Answer number 5. Blood clotting හොඳට බලා ගන්න, because there's a possibility. Okay, then 23rd question, we'll move to that. But they ask, 4 respiratory volumes of a resting person are as follows. So lung volumes තියෙනවා, lung capacities තියෙනවා, right? So lung volumes, 4 lung volumes. So you need to remember their definition, what that particular volume, then tidal volume, what is tidal volume? So you should be able to write that. and also the value of that. කොච්චර value එකක් තියෙනවද කියලා. There's a graph also in your resource book. You need to remember. And lung capacities වලදී වෙන්නේ lung volumes, 2 or 3 lung volumes combined together and forming it, right? So here they mainly ask on lung capacities. So find the answer. Before that, can you quickly write what are the 4 lung volumes, their definition and also the value? Quickly write. I will give 5 minutes.